All right, can you hear me now? Oh, yes, great. Great, yes, but we are muted. Okay. Okay, great. Sorry about the technical difficulties. Let me just start us over. So hopefully you can all see my screen and hear me well. All right, hello and welcome to the Early Childhood Innovation Zone Data Collection webinar. We appreciate your time as we share important information about data collection for Innovation Zone. My name is Renee Petrick, Program Innovation Analyst at Illinois Action for Children. I'll be facilitating the webinar today. Also with me on the webinar is Leah Powell and Agnes Marcos. We're glad to have you all here today. Before we get started, let's briefly review some helpful GoToWebinar tips. If you're calling in by telephone, please mute your phone. If you're using mic and speakers, please also mute yourself. If you have a question during the presentation, feel free to jot that note down to yourself. And you can type that question into the chat box and also raise your hand. When you raise your hand, we can unmute you and you can ask your question aloud. Agnes is also here with us and she'll be reviewing the questions so that we can share those out loud with the group. And we'll also stop periodically to give you some time to ask those questions. If you have any sort of technical issues, please email Agnes. Her email address is right there on the screen for you. All right, let's go ahead and get started. As part of the webinar today, we will briefly review the purpose of today's meeting. We will then give an overview of Innovation Zone goals and measurement plans. And then we'll discuss our various roles and responsibilities with data collection. Next, we'll review the data collection forms and process. During this section, we'll pause several times to answer any questions that you have about the forms and process. Finally, we will review our timeline for data collection. I'm going to turn it over to Leah now, who will talk with us a little bit about Innovation Zone goals and measurement.
Thanks, Renee. Thank you so much for getting this organized. And everybody, thank you very much for taking the time out of your day on a Monday to work with us and build our skills as we start this part of the data collection process. So now here we are, we're in our second year of this. And for our Innovation Zones who have just joined us, this is your first time going to be working through this. And we really do want to encourage you to ask as many questions as you have. If you're not able to get the questions out today, or if things come up and bubble up as you're starting to do the work, Renee and Agnes are here to support you. I'm also here to support you. So we don't want this to feel like anything that's too hard or too challenging. We want this to feel feasible to you, and if there's anything that we can do to help make it easier for you, by letting us know, we will know how we can support you the best. So just as a refresher, the goal for our Innovation Zones, we have two major goals. The first one is to increase enrollment of priority children in high-quality early learning and development programs. So we want more of our priority populations enrolled in high-quality early learning and development programs. Our second measure for Innovation Zones who have selected this as a goal is to increase the number of early care and education programs who have applied for an ExceleRate Circle of Quality or movement up in the QRIS system, ultimately with the big picture goal of having more with silver and more with gold circles of quality. So to measure this, our enrollment goal is tracked by tracking the number of children who are enrolled from these different populations, along with those changes over time. So we're looking at a year-over-year improvement, year-over-year change of priority populations who are enrolled in programs in your community who are from priority populations. And so each of our Innovation Zones have selected different populations to be working with. So maybe you're looking to identify, recruit, and enroll more homeless families, identify, recruit, and enroll more children with developmental disabilities or delays, more children with teen parents and poverty and deep poverty. For our quality improvement goal, that one is measured by tracking the number of programs that are rated in the state's QRIS system, as well as the number of programs that move up from any quality level to a higher level. So in some of our communities, QRIS, the ExceleRate, was new, so they weren't in the system at all. So if we have folks who have applied, if we have folks that are at bronze level, some people went through the different crosswalks, the assessment paths. So if maybe they went from NACI and now they're gold, So we're looking to see year-over-year changes in the number of high-quality programs as measured through ExceleRate. So why are we measuring all of this stuff? So as you know, innovation zones are an experiment. We are piloting different strategies to help the state learn. So the big picture is to help the state learn how early childhood systems might be able to shift policies to better increase access to high-quality early learning. So does our work in the community help to make an impact for families? Is this the different strategies? Is this the community systems work? We're able to get data from the communities and then use feedback loops to help connect that data back to either the state systems or the city systems. We're also looking to see on the local strategies themselves, did we increase enrollment? Did we increase quality? And then can we share that out more broadly? Is that information that can be scaled out to other communities? Can other community collaborations benefit from the work that's working in your community? Can the state make recommendations to other state agencies to help make an impact to increase access for families and to also increase quality? And then the last point is really part of this action learning. So we look at it as a developmental evaluation. So it's both to help you learn and it's to help us learn. So how can we, based on the data, based on the information that we get, that helps us know what's working and not working. And if we don't have data, we're not going to know if we're making an impact or not. So we look at it not as you've heard me say this before, there's no failure, there's only learning. And without this information, without having different types of data points, we're never going to know what works and what doesn't work. So if we have, if we're moving along with a strategy and moving on course and then it's working, that gives us information to help us know that we can scale that out. If we're moving along and something's not working, we're not getting the data, we're not getting the impact, that also gives us information to help us know that maybe that strategy isn't the right strategy for the families in our community. We can try something else, we can shift, we can pivot to try something new. So some of the information that you could get, as we've talked about, through feedback loops, it might come from coaching, it may come from surveys, the progress notes that we get from you quarterly, both in the check-in calls that we have. We keep track of all that information and then share it through the different channels that we have. Sometimes we've been working with innovation zones to help write up an idea, and then we can give that directly to OECD, and then they can make decisions about how to move forward. We've been thinking about how we could really take our system of data and information and really become much more systematic this year. Over the next couple months, we'll be reaching out to you to help us be a part of that. So to take this data, not just for you, to help you learn, but how can we help the state learn? So we really want to be impactful and intentional about that this year. So all roads lead to outcomes. So some of you have heard me say this before, and I hope that this isn't the first time. But one of our shifts now that we're 18 months in, and then for our new innovation zones, it's really no new activities. And then if we do have new activities, that all roads will be leading to these measurable outcomes for Race to the Top. So this is something that we created at the beginning of the innovation zones. And this is just one visual representation of all of this stuff. So in our top quadrant on the left, that's the who. So that's who are we working with, who are we identifying, who is our priority population that we would identify, recruit, and try to enroll in programs. The second one is the why. So this is our theory, this is our hypothesis, this is what we think through our root cause, what is the barrier, why these families are not connecting to early learning programs. And then the how is what do we think? So what could make the difference in our innovation zone? What's behavior change, what's the policy change, what's the practice change that would make a difference for increasing access or enrollment for our families? Or what activities would help us achieve the goal that more children who are very high needs are enrolled in high quality early learning programs? So in the green box there, we see what the measurable outcome is. So that's all roads lead to enrollment of more priority populations that are served, high quality, so again, gold or silver, so more high quality programs. And then aspirationally and ultimately, it would be enrollment in high-quality programs. So more priority populations are served and enrolled in high-quality early learning programs. So we know that this work isn't easy. We know that you guys have been working super, duper, duper hard to make measures and to make impact on this. We want you to be able to get the credit for all the hard work that you're doing. So that's another reason why this data collection is important, because if we don't know it, we can't tell your story. You can't tell your story. If we don't have it in some sort of a documentation, we're never going to know if any of this stuff is working. but this is only one piece in the puzzle. So communities and systems are dynamic. Our strategies and our analysis of this might need to be adaptive, so that's why we use this developmental, really action learning approach to keep designing for change. So we don't focus as much on outputs, maybe as you might be used to working on in kind of a program lens, but the system lens allows us to keep our eye on the prize, which would be this outcome, so that we can kind of shift in the middle. So we've got, big theory, who we're going to help, why, how we're going to do it, and that how can sometimes move around, right? So maybe we had an activity, maybe we had some theories when we first got started, and maybe that shifted a bit. But we are always going to be working towards these outcomes for more kids enrolled in early learning programs. So this picture here is it's that same table, just the same little smart art thing just laid out into a table. So you can see, this would be your innovation zone. Who would we be helping? Why are they not accessing early learning programs? What is our strategy? And then that last column is the measurable outcome. So for example, we have here that if we were looking to help families who are in poverty or deep poverty, maybe the reason why they're not accessing early learning programs is because they're dealing with issues of scarcity, so it's just very hard for them to navigate our systems. So our solution is that we might have a pipeline where we're communicating and giving messaging to pediatricians, and we have an outreach toolkit, and then we have a whole system in place to really connect pediatricians who see very high-need families into early learning programs. And so our imaginary outcome would be that through this relationship, 27 families who are living in deep poverty enrolled in programs, maybe 43 families living in poverty were served by early childhood programs after the treatment, which would be the pipeline in year 1. So then in year 2, hopefully we're building this relationship, we're deepening our impact. Either we're working with more and more pediatricians, we just stick to our activity of working with pediatricians to reduce barriers, and then next year maybe that would double. So maybe we have almost 60 families from deep poverty that are enrolled in programs, and maybe 80 families from poverty. So year over year we're looking to make improvements. But then maybe in year 2 we're finding out that, hey, pediatricians are kind of limited, so maybe I can go work with the public housing partners in our community, and maybe we can actually help to increase more families in poverty and deep poverty by adding another strategy, but all roads lead to more kids served enrolled in early learning programs. All right, so not to beat a dead horse, but here's another visual of the same thing. Some of you have seen me do this in live time, but these are my bubbles, like the little clouds. And it's kind of the big behavior. So anyone who's going through the Able Change will know this as big P, little P's. So we're looking at big B's and little B's. So big B and our big cloud up at the top would be the state's vision for children. So that's that more children begin kindergarten safe, healthy, ready to succeed, and eager to learn. They celebrate, this is their whole state vision, which is on the Early Learning Council website. But they're committed to universal access for all children birth to 8 and high-quality programs with prioritization for children with high needs and families that are hard to reach. So as part of Race to the Top, what I did is I broke out those two bubbles. So the Race to the Top goal is that you would have more very high-need children enrolled in high-quality early learning and development programs. So one bubble on the left is more programs apply. And then if you drop that down, it would be that more centers, for example, might participate in the leadership development program, which would lead to them applying, which would lead to, according to the theory, more kids beginning kindergarten safe, healthy, ready to succeed, and eager to learn. And then on the right side, so if we want to increase enrollment, we might have more children who are successfully transitioned. Maybe we've got more referrals from non-early childhood partners, maybe more engagement with families through developmental screening campaigns. So the work that we're doing, all roads lead to increased enrollment and increased ExceleRate circles. And here's one more version of the same thing. So this is something that I've been working on just to really, the reason why I'm really putting a lot of emphasis and focus on this is you've heard us talk about the logic model. So, if we're trying to get to California, it's easy to get sidetracked. And some of you, I've talked to you about laying it out on index cards to make sure that all roads lead to enrollment. This is the way that I'm doing this to help track the work that we're doing to make sure that all of our our order and flow and logic all leads to the destination that we're looking to do. Once I have this complete, I'll be able to send this around to everybody. But this is something that we are hoping that all the innovation zones will keep doing so that you can see through a strategy map a different flow that everything, all activities and things like that are going to lead to more access, and then more quality in your community. We want, again, I'm going to say it again, so we're not looking for innovation zones to have, the current innovation zones to have new activities necessarily. We really are looking for you to refine, enhance, strengthen, and then through this data collection process, it's really going to help us understand what we're doing, what's working, where do we need to improve, is there anything that we need to throw out at this point that we put a lot of effort in that just is not working. So if we've, you're just trying and it's just not working, well, the data is going to help you know what you should keep going on, because we really just want, at the end of the day, those numbers on enrollment and those numbers on quality are going to be the measures that we're going to share with other folks so that they can say, hey, this stuff is really important, this is really impactful, you guys are really making a difference. I'll underscore that I recognize that it's aspirational, just in the sense that we can't control what families choose, but what we can do is to help reduce barriers. We can reduce different friction points just to make it easier for them to have the thing that they want. So we're going to start with the assumption that they want it, that maybe they're not getting the right reminder at the right time. They really want it, but maybe it's just really hard for them to do. So we're going to just play around with really trying to make it easier for families. And if we can make it easier, does that actually increase access? So in some ways, it's kind of what we're testing. We're testing if we make it easier, if we make our system work better, if we work together better as partners and pipelines and things like that, can we actually make that difference? So all this really does just help us learn, and your role, your help in doing this is just super powerful to give us the data that we need. So we know that it's a different approach. So in an ideal world, we would have some sort of a easy database that all of our centers, all of our child care centers, all of our preschool for all programs, all of our Head Start programs would be entering in the same data, and it would be an easy system for us to collect all that stuff. But what we've learned is that our ideas, so it's not just my ideas, but it's kind of the whole race to the top nationwide, just the world of data in general. So we have more understanding of how to use data than ever before, but our systems are really about 20 years old. Like the way that we collect data, and it takes a long time to change practice in governments and in bureaucracies. And again, not just in Illinois, but kind of across the board. It's not just in early childhood, but medical systems and medical innovation. I'm sure that some of you have gone to the doctor and you can see how hard it is for them to switch over to electronic medical records, but this is just a reality. So we're doing our best, and what we're able to do through this process here is to give really good information to the state about this is how much work went into our local programs and our local partners collecting data. Just so you know that. So we understand that this is some steps, but we're getting alignment, which is nice. So for the Early Learning Council, the priority populations that were selected for the innovation zones, and then are also a main part of the work that's going on with the preschool expansion grants, would be that helping families who are homeless, helping teen parents, child welfare system, developmental delays or disabilities, poverty, deep poverty, and linguistically isolated families. So some of our systems do collect this data, and we're going to keep trying, and we're going to keep doing our part in partnership with you and information from you to really keep pushing a better, more aligned system, but we're just not there today. And that's something that we are advocates for. Every call that I'm on, if you ever hear me on a call, I'm really talking about, okay, let's get program level data on these different populations so that we can measure impact. So just so that you know, I'm a champion for that. But one of the assets for us as community systems and working together in collaborations is that by sharing data together, and if our community systems are working well, so that's our goal and our vision for all of our collaboration work, is that the schools and our center-based programs, they want to share the data with you. They're going to want to do that at every meeting because it is a win-win. If we're working together as a community to identify, to recruit, and enroll very high-need children for everybody, this is a win for everybody. So we shouldn't be working in isolation. And you know that we have partners who really have been our partners for a long time. They're the ones with whom it's going to be easiest and best to get that information from. It's going to be harder to go out and ask some stranger, hey, can you share your data with me? But you've been working in your innovation zone, both the new innovation zones and the innovation zones who've been with us since the beginning. You've had partnerships and relationships in the community that go back at least 3 years, 5 years, some places it's 10 years. This is a real strength for the work that you're doing. So you just keep working closely with the partners that you work with the most, the ones who are at the table. Those are your strong community systems. When that is working well, they want to share this data with you because it's a win-win. You're helping them They're helping you, you're helping them, they're helping you. It really just is it's like a feedback loop of good communication. Great, thank you so much, Leah. And do we want to pause right there? I went through that information pretty quickly, and I want to give just a quick second to see if there's any questions that came up before we go back to Renee. All right, great. We don't see any questions coming up yet. Do feel free to raise your hand or type into the question box if a question arises, or feel free to jot them down yourself, and we'll break again for questions in just a minute. Great. So you're probably wondering, how are we going to collect this local level data? Let's start by reviewing our timeline for data collection. Here's a general timeline for data collection. We'll collect both enrollment and quality data this fall, again in the spring of 2016 and in the fall of 2016. So there are 3 more times to the end of the grant cycle for data collection. And again, our grant ends in December of 2016. To collect this data, we'll use a point in time for enrollment. For this fall, the point in time is October 15th. This date is chosen because most programs are fully enrolled on this day, and it gives us a good picture of what enrollment looks like across innovation zones. This timeline here is a little bit more detailed for you. Right now you can see we are over here and we are preparing for our data collection cycle. Today's webinar is focused on that quantitative data, so looking at program enrollment numbers and quality numbers. We'll go through another cycle of data collection in the spring, and then again, the next fiscal year, we'll follow the same general timeline of preparing for data collection and then collecting that data and reporting back on that data. So to collect that quantitative data, we have a few forms that we will discuss here today. We have 2 enrollment forms and a quality form. We also have a sample intake form to share with you, and we also have documents for tracking the data that you collect. So we're going to walk through enrollment and quality forms in detail. Here's a look at them right here. And we're going to take a closer look at the sample intake forms that you received. So you're probably wondering, how are local innovation zones going to collect this local data? So let's review our different roles and responsibilities. Participating early childhood education programs are those with whom we work closely with in the pipeline. We're going to ask that they attend our data collection information session in the innovation zone. We'll talk more about that. And that they complete and submit the data collection forms. We know that collecting data sometimes can feel like a burden, and sometimes we wonder where that data goes. We want to tell you what happens with that data. That data really is for our own learning, planning, and development as innovation zones. With this data, there's no judgment. There's no failure. There is only learning. We're not interested in any sort of vanity metrics or at looking at outputs, as we talked about before. We really are working towards outcomes for children and families. We want to keep our eye on the prize and truly understand what worked and what didn't. We want to learn and we want to improve. And that's what we're going to we're going to share with our early childhood education partners, and what we're going to focus on going forward with data collection. As an innovation zone lead or coordinator and our data champions in the innovation zone, your role is to share all data forms and materials with your early childhood education partners. We suggest that you also schedule a data collection information session with your partners, and we'll talk about that. You will collect enrollment and quality data from those programs, and you might do this by sending out periodic reminders to your programs about submitting that data. Those triggers and those reminders really help. You'll be there to support your
early childhood education partners to answer questions, provide technical assistance as needed. And we want to help you with that. Use us as a resource. We are your resource. Try to make it fun for them, use visuals or other incentives to build their participation, and talk to us about ideas. We're happy to help you. Make it social, make it easy, make it fun, and support follow-up as needed. Let them know that you're in it together. Be there for the team and see yourself as the team. Support those with questions. And then you're going to submit that data in those forms back to us by November 20th, and we'll talk more about that submission process. So your role with data collection is really to help. It's to support, guide, and encourage. Again, consider how to make this fun for people and make it easy. You can do this by increasing motivation, by removing some of the fear and providing encouragement to your partners. It's also easier for our early childhood education programs when we help increase their ability, which can be done by providing forms, tools, and additional support. We can also help by providing regular triggers and reminders to our program.
And I'll just add really quickly on the motivation, one of the ways that we can do that is by, as Renee said, reducing anxiety, increasing their feeling of hope that they can do this. This is possible. This is really achievable. There's a reason why we do it, so a sense of pleasure or a sense of social. So as you're really working with your partners to do this and having conversations with them, it's a perception of things being difficult that can make things difficult, and we can play around with that by talking about data in a way that isn't so intimidating.
So again, we're here to help. We're happy to meet with your Innovation Zone and your early childhood program partners. We can help provide information and training in person. We've distributed a sample intake form for your use with your partners. All priority populations are listed on these forms, and this is something that could be easily used at intake to collect data. We're also here as needed to answer questions and provide technical assistance. We'll be sending you additional tools to make things easier. We have a step-by-step guide for data collection, which includes some messaging for you to adapt and use with your partners. We want to make this process easier and have designed this process with you in mind. Do let us know if you have feedback. We're learning as we go, and we want to learn from you. So let's pause just for a second. What questions do you have? Trish, I'm going to unmute you now so you can ask your question aloud.
Yeah, so,
go ahead.
Okay, can you hear me okay?
Yeah.
All right. So you had shown on the screen the preschool expansion eligibility and the shared intake for IZ. My question is, when you look at those two forms, obviously the weighted the criteria are very similar, and as you were just sharing, how do we make this be not another burden on our partners? So I'm wondering if there's been a conversation with Brian between these two forms and the weighted eligibility form in order to be able to capture some of that information.
And do you mean in the sense of not having a double collect?
Yeah.
I think that's a great idea. I have had some conversations with it. And I'll follow up with Brian directly and then get back to you on that one. I do think that there's an opportunity, but I'm not sure how much of their system is ready, so we'll find out for you. If it's the student information system that's from ISBE, that would be the space that we can get that from.
Okay.
Now, one thing I'll add is that Teresa does feel strongly that, to the extent that we can, I know it's there's sort of a twofold thing. So one is if we can get data from a system, that's easier, and our partners are not having to double collect. But if we're going to the system to avoid talking to our partners, she would prefer that we just ask the partners to share the data with us. Does that make sense?
It is. I mean, obviously, like for us, we have so much preschool expansion, and we're with these guys on a regular basis, and I only bring this up because they're feeling stressed about all the things they have to implement. So if we ask for another thing that's so similar, I just want to be able to navigate through that
Okay.
and not overburden them.
Great. So maybe the question is, how can we leverage the data that they're already collecting for preschool expansion grant and create maybe some sort of a seamless or an aligned process?
Yeah.
Is that right? Okay. Thank you for that. So we'll put that in our notes, and then we'll follow up directly with them and then get back to everybody so that you all can hear the same answer.
Thank you.
Great. Thanks so much, Trish.
So we have a question that came in that asked, when would a program complete the intake form that you shared with us? Because we don't want to offend or put off parents when they're trying to enroll in the program.
Okay, so that's a great question. And one of the ways that we've envisioned this, so when the programs are doing intakes with families already are completing a lot of different types of information. Most of the, for preschool expansion, or preschool for all, the supplemental or sort of sample intake form is not unlike some of the questions that are asked already for preschool for all programs. To the extent that it feels invasive, we would give the option for a family to not have to answer everything. They're not obligated to answer these questions, but it would be something that would be part of the regular intake paperwork with a family. So it feels like this is part of what we already do. And then if there's something that they're not comfortable answering, then they would have permission to opt out, since it's not a required process. But to the extent, I would say that some of this stuff is already collected for their programs already. So for Head Start, income eligibility is requested. For Preschool for All, income eligibility, some of these fields are already requested for eligibility for our public programs, our publicly funded programs. And what the intake does is it just gives a cover sheet that has it just has aligned questions right on one page.
We have another question about how to make this easier for programs, especially with programs being strapped for revenue and capacity. We're going to go through the webinar and see if we can answer some of those questions, but do feel free to bring that back up, and we'll make sure that we address that question completely. All right, I think that's all we have for now, but continue those questions. Let's take a look at the forms. We're going to start first with enrollment. So here again are the sample intake forms that you can use with your innovation zone. This was emailed to you this weekend. Feel free to pull that out now. This form can be used, as we talked about, at intake to help collect data about families within programs. We have it here next to the preschool expansion eligibility and enrollment form, so you can see how similar they are. So again, this is an option that you can use with your families, a tool that you can use at intake. So again, this is a tool for your early childhood education program. Perhaps some of your programs are already collecting this information. If not, this tool can be used now and going forward to collect this vital information. This form helps us learn about our program participants and the strategies. So this is our form HN16. So this form goes to all participating early childhood education programs. So we know this form is called HN16. We know it kind of sounds like a vaccine or a virus, but the reason we call it that is because HN stands for high needs, and 16 is the fiscal year that we're in. This form goes to all early childhood education partners in your innovation zone. We encourage you to focus on those ECE programs in your innovation zone that you're closest to. Those are the ones that you're working with on your high needs strategies. The purpose of this form is to collect total enrollment and priority population enrollment. This form is completed twice a year, once in the fall, once in the spring. And for this fall, we're using enrollment numbers on October 15th. So again, that's our point-in-time snapshot of enrollment. Our data collection champions in the Innovation Zone will help collect this information. We suggest you have an earlier submission date of November 13th. This will give you time for follow-up and time to review the forms before they're due to us on November 20th. Every Innovation Zone will be using this form or the other enrollment form that we have, which is called HN16 Part A. Part A allows programs to submit overall totals, so this will become more clear in just a second. We encourage programs to use Part A if they're able to generate their own data reports and simply input totals. So we'll look through both those forms now. Here's the instruction form, the instructions for this form. Let's walk through the form using these instructions. Here's what the first page of the form looks like. Let's go ahead and make this a little bit bigger and walk through the sections of the form. At the top of the form, you'll see some fields for the program to enter their program information. So we're asking for basic contact information and program type. And then here you'll see programs will enter their child ID, a child ID number, not a child ID name, but a child ID, zip codes for that child or the children in your program, priority population, and referral source information. The table headings that you saw on the form can be seen here on the second page of the cover sheet with their corresponding definitions. Here you can see all the priority populations and their definitions. We tried to make them as clear as possible while still staying true to the research-based definitions. In the form, in Table B, the programs will check all categories that describe the priority population characteristics of that child. In Table C, programs will check all categories that describe how each enrolled child's family reported learning about that program. Forms have been individualized for your Innovation Zone to include your unique strategies. So for example, Cicero is using a strategy of pop-up preschool. So on their form, they would have a category for pop-up preschool as one of their referral sources. Here's the last page of the form. And for this section, programs would total the columns here for tables B. So there's an option here to total the columns for tables B and C. This will give a nice view of which priority populations are being served in your program, as well as the referral methods of families. Programs are also asked to include overall total enrollment, found here in Table E, and total priority population enrollment. The cover sheet includes directions and instructions on how to total these categories. We know this can be tricky, and we want to advise programs to use these instructions and ask questions as needed. We're happy to help walk through the process of totaling the forms. We also have the forms available in Excel, and Excel makes it really easy for totaling. Programs can simply insert a 1 for each of the categories in the spreadsheet, and it will automatically add the totals for the columns. Again, we're happy to help with the totaling process for the forms. All right, so that's HN16. I would like to pause here just to see if there are any questions about form HN16. Okay, so programs can choose to either complete HN16, the form we just reviewed, or this form here, HN16 Part A. As you saw, HN16 allows programs to enter individual child data to then total the information. This form here, Part A, can be seen as a program summary form, or a way to simply submit program totals. We are interested in those program totals. So if a program can easily generate a report or calculate totals, we encourage them to use this form here, Part A. Let's take a look. Here's the form itself. You can see this is a shorter form and allows programs the opportunity to insert overall totals. The cover sheet of the forms are similar with slightly different instructions. Again, this form goes to all participating early childhood education programs in the innovation zone. Programs can choose to submit program totals on this form or use the other form to help calculate the totals. This form has the same submission dates and process. Here's the instruction sheet. And here's the same page with definitions for priority populations and referral sources. This is a handy reference page for your program. The form asks the same basic program information, as you can see here. The program can then insert zip codes, as you'll see on the left-hand side, and corresponding data. Here, programs insert totals for each priority population by zip code, along with referral sources by zip code. You will see here a place for overall enrollment, as you did on the last form, and a place for priority population enrollment. The purpose of this form is to make it easy for programs who have the ability to generate their own data collection reports. They can simply enter the totals and share the totals. This form was created because we got some feedback from the innovation zones, from early childhood partners, who said this would be easy for them just to submit the totals. So we created this form based on that feedback. So this is very important. Programs can use either form. They do not need to complete both forms. They can choose between Form HN16 or HN16 Part A. Again, the difference is that HN16 allows programs to input individual child data, whereas Form HN Part A allows programs to submit program totals. Are there any questions about these forms?
Okay, so I just want to respond to one question that we received. It was sort of a question comment about, you know, how for the preschool expansion grant and TFA information being entered into SAS. So I actually sent a message just to Brian and Teresa, so maybe we'll be able to hear back from them by the end of the call. I let them know when the call would be up so that we can be responsive to you in the moment, and then otherwise we'll just send an email around with some more information. Okay. Great. Okay.
So we also received questions from innovation zones about tracking their own strategies for intake, referral, and enrollment. Yes, yes, and yes. We strongly encourage innovation zones to track and document their strategies, learning, process, and data. Here's one way you can track your own intake and referral data. We call this the Outreach Tracking Tool. This is on the Google Drive and can be adapted for your use. Let's take a look. I'm actually going to invite Leah to come and show us how she's used this form. Leah's recently been doing a snap test on Outreach and is going to talk to you about how it works for her. So I'm just going to pull up the actual form here from our Google Drive.
Okay, so what I've been doing is, so some of you know that I've been working with a pediatrician that I know, and when I get calls back from, so what she's doing is she's giving my direct phone number, my office line, to families that she's engaging with. If they want to learn more about early learning, she says, okay, here, you can call my friend Leah, and then she'll talk to you. So when I get information, what I do is I just write down the name. So this is my internal tracking system. So I can write their full name. So I could write Rachel Cunningham. That's my sister, just so you know. So referral received from, and I would write down the name Dr. Jenny Hassler, so who I got the information from. If I was working with the homeless shelter, I might write the Salvation Army right there, and I could write, case manager John Herbst, so that I knew exactly who it was that I worked with there. Their role within the organization, so she would be the doctor, he would be the case manager. One of the reasons why we want to have it like this is that inside of your group of people, so if I was out and then Renee got the phone call, that she would be able to jump right in and know who it was that I spoke with. So this is one way for your own developmental action learning, like the developmental evaluation for your own internal tracking. If I had an email address, this is my sister's actual, I'm not being creative, this is her actual email address, you rock so bad. And then I would write her phone number, 773-867-5309. Her address, I would say, let's just say Boston. So long story short, we basically have this filled out so that we can know who it is that we're talking to and have some sort of a tracking system so that we're not having to remember all of this information. We can go back to it later on. So one is it helps me track what I've been doing. It helps me stay in touch about a particular client, almost like case management notes. And then it also helps me to track later on. So how many referrals did I get from Dr. Jenny? Rachel contacted me on the 17th. The results of our first approach was that I talked to her. So it's sort of like, I don't know if anyone is a case manager has ever done case management or intake with families, but you keep the language very neutral, so it's not subjective, it's not judgmental. It's like I talked to client or I talked to Rachel. Client stated, Rachel stated that she was looking for early learning programs. I might note that she's, in the priority population or teen parent, that kind of thing. And then what we're trying to do here is these questions that we had talked about to help us understand more information from the family. So does Rachel want to learn about early learning? Is it really easy for her to learn about early learning? This is what would help the family connect. So we can ask those questions when we're on the phone with them, just because it really helps us get more information in our engagement with families. Any notes or comments? So this is to update it every time. So like if I had my first call with her on the 17th, and then on 8/17, Leah called EI to connect Rachel. And then a couple days later, I might say 8/23, EI called back. And then these would be my next steps. It would be Leah to call, Rachel Cunningham in one day. Okay. And then this right here is just to help us. So like, where were they enrolled? So I'm going to follow up. Did I send a text? Did I do something, right? And then what was the action? So did they enroll? Where did they enroll? When did they enroll? And then this idea of learning. So part of it is twofold. So learning from Dr. Jenny. So Jenny's been giving me some information about the families she's been interacting with, and then just questions that have bubbled up for her. We can keep track of that to help us learn and be responsive in our pipeline relationship. But then also, what did I learn about IFSPs and school system? So when I was talking to the CSC manager, she gave me a whole bunch of information. So I might write down like new information that I didn't have before that would help other IZs, or that would help, sort of help the state. So it's sort of like the learnings, and then you can save that and then use that to put into your quarterly report, because you're always learning new stuff from the field. You're also always learning new stuff that you can bring back to your collaboration meetings, and then you guys can talk about that together. And then this is kind of our post-engagement analysis, so how many engagements before enrollment. So if it took like 6 calls, that's okay. Documentation, this would be like I took a picture, I texted and I took a picture of that text. Okay, so the reason I really did do this, I did take a picture of a text that I sent so that I would remember that it worked, and then I could use it again. Okay, and then where did I put that file? So it's more for my internal tracking. So this isn't really for anybody else. This is really an internal process. You can take and aggregate this data and then put that into your own forms. But this helps you know what you've done and to really get the credit for the work that you're doing, and then it also is part of that action learning process. So I hope that's helpful.
Great, thanks so much, Leah. And this form has been included in each of your folders. So we have a data and evaluation folder right here that I can show you. So here's our data and evaluation folder on the Google Drive. You'll go to IZ Data Collection Info Fall 2015. and you'll see all the forms have been added. You have individual folders that have all of your forms that were sent to you this weekend, and it has that outreach tracking tool in there as well that you can find right here. And I'm happy to walk through the Google Drive with you at any time, and we'll be adding supporting documents to this folder here. Great, so let's shoot back over to our presentation. So that was the outreach tracking tool. And now we're going to take a quick look at a form we have for quality improvements. So this form is for innovation zones that are working on quality as a part of their work plan. So this is, right now it's for Aurora, Greater St. Louis, Thornton Township, and Williamson County. New innovation zones are focused on high needs right now and don't need to worry about this form. We'll be meeting with you in the fall to discuss high quality. We know that the innovation zones that have used this form before, you've gone through 2 cycles now, last fall and last spring, and I know that you're old pros at this. So we'll just go through this quickly so that we can have a little refresher on quality improvement. So you've seen this form before, and you've used it last fall and this past spring. So let's take a quick look. So here's the front page that you've seen before. This is our ExceleRate Program Quality Form Q16. So again, Q stands for quality and 16 for the fiscal year. This form goes to all Innovation Zone leads and coordinators. Innovation Zone leads will work with their participating early childhood program leaders to complete this form. So this is the Innovation Zone leader that's completing this form on behalf of that program. So this form indicates the extent to which the program has reached an ExceleRate level or the extent to which they've begun to address quality. This form is also mailed or emailed to me, Renee. We're asking for quality rating of the program as of October 15th of this year. Please also submit this form by November 20th, and we'll collect this form again in May. So here's the instruction sheet. You've seen this before. And here's the form itself. You'll check one box for current quality status. So again, we have at the top, you'll include the program information. And then here in Table A, you'll include the current quality status of the program. You will then check one box for the quality target of the program in Table B. And then you'll check all categories that describe where the program is in the quality process in Table C. So all the things that they've done to work towards quality.
And again, we just want to underscore that if where we say no new target, that's okay if there's no new target. This is for your, in many ways, this is for your internal process. This is, again, for us to learn. We don't want you to feel like you have to push programs further than where they are. By knowing where they are, that's where they are. And then we get information about where they're at. We don't want to be unrealistic or strain any of the relationships that you have in your community. But if you have new targets, that's excellent. And let us know where you're moving to. And if you have none, that's still okay, just to underscore that.
And then this second page here is for programs that are working towards silver, gold, and an award of excellence. They would complete this page, which tells a little bit more about where they are in the process. And then this last page is really just for any additional comments that you or the program would like to add about their quality data. So that's it for the quality form. Any questions about Q16 and quality improvement data?
Okay, so we received one question in the last segment about the accuracy of the data and wondering how the data is used and how the data from last year was used. As we're learning, so this, as we've said, this is a learning process, and we sometimes also have concerns about the accuracy of the data, but this is part of our learning process. So we are feeling that the information that's coming in, it's almost like a year-over-year improvement. So on one point, the number of programs, so some of our communities, maybe they have 30 between schools and centers in their community, and then we got information from 5. Maybe next year we'll have greater accuracy because we will have more programs because our relationships have built year over year. So greater networks, greater collaboration increases the accuracy because year over year we're improving. So that part counts. Year over year, more programs participating and sharing data. That's showing the strengthening of the community systems. It's evidence of a stronger collaboration. In that sense, I hope that that's helpful. We can also abstract from the data that we have that it can be representative of information in the community. So it may not be wholly representative. We know that this isn't sort of the gold standard, randomized controlled trial, but it is giving us information. How the data is used, again, the information is used, ultimately it's used for you and it's used for us just to help us see. Last year it was what is the state of the world? So what does it look like? How is it to collect data? How is that processed? Is it hard? What did we learn about community systems? I mean, it was really just informative overall. And then we also have reports from U of I, which they did send around, I know, to each of the innovation zones so that you can use that in your community. And then I think, hopefully, again, to the point of vanity metrics, that we really want to know year over year your improvement in your work in the community. Okay, and then some of the information that we get from you, that's sort of self-reported data, we are able to share that kind of as a little bit of progress report. So this is evidence of change of the community systems working. So when we got information about the screening collaboratives, the screening campaigns, professional development work, a lot of the stuff that you're doing in the community, doors knocked on, families engaged, families enrolled, that helps us know what's going on. It helps us tell your story, but it also helps you tell the story. So it's really about sharing the results of your work. As we said, sort of what's the impact, what's happening, how can the state learn, and then for action learning.
Great. And I don't see any new questions, so we'll go on and move forward. So I'd like to take this chance just to ask, what would help you? And what would help make things easier to collect data in the innovation zone for you? So as you're thinking about that, these are some ideas that we've heard from you that I wanted to reflect back. So like we said, we truly want to help you and make this easier for you. And here's a menu of supports that we'd like to offer based on some feedback that we received. So in the next couple days, I'll be reaching out to you to set up one-on-one calls, really just to check in on how things are going, answer questions about the forms and the process and the timeline, and just to generally offer support to you and to your innovation zone and to your partners. Last year, I visited many of the innovation zones to deliver in person a data collection information session. So this is optional, but it's strongly, strongly encouraged. It's basically a how-to session on collecting and submitting data for your early childhood partners. So I'm happy to do this again, and we can talk about that when we discuss one-on-one. I can also review any intake forms from your early childhood education partners. I'm happy to walk through the forms with them, to help them to transfer data from their intake forms to our data collection forms. I actually did this in Cicero for a few different programs, and from their feedback, this was really helpful to their innovation zones. So there really are many, many options, and it doesn't stop there. And I welcome your feedback and your ideas on what has helped you, what would help you going forward. So please, please, please let us know. We want to learn from you and grow with you.
Okay, so what was with the letter that we that came from Teresa from OECD be used again this year? The answer is yes. We could have that updated. What we have right now is the version from last year, and then if it is important to put a new date on that, then I'll work with Teresa to get a new date on that. Okay. The second question or comment would be incentives for child care centers and other programs who we want data from but are not necessarily gaining anything firsthand in return. So there's two thoughts on that. So one is hopefully what they're gaining from the relationship is that they're getting their slots filled. You're helping to build a relationship to help them, that they can see that there is something that they get out of the data sharing. Now, in the first year, it might seem a little bit strange since they're getting to know you, and this is kind of a new relationship and a new process. Incentives can be tricky because they cannot be sustained, and they can't last, and they can get really expensive. and they don't necessarily change a habit. They don't necessarily change behavior. So we've done a lot of research on incentives. Almost when you think about paying people to quit smoking or paying people to do their homework, you end up getting very short-term results when you're not actually building a relationship with them. It isn't something that they're embedding as like a continuous practice of their own. With that said, I would be interested to hear other ideas if there is a way that incentives can be affordable, that can work, and can also work towards habit building. Because to me, the relationship that is what's sustainable. So building that community system, building this as something that a new way of practice of sharing information, we'd be curious to know. That's actually like the long-term vision, is that the sustainability would be that this is just how we work together as a local community system.
And I see that, Angela, your hand is raised. Did you want to ask the question aloud? I'm going to go ahead and unmute you. You can let us know. You're unmuted, Angela. Okay, that might have been an old hand, so feel free to type in to the question box or raise your hand again, and we'll make sure to address your question. Okay, great. So we'd love to hear any thoughts you have on that last question about incentives, so feel free to type it in the question box. You can also send those by email if you want to share those with your fellow innovation zones. So we're going to go on to the next portion. So again, with our menu of supports, one way to make things easier for your early childhood program partners is to offer a 1-hour in-person training with your participating early childhood programs in your innovation zones. So this was helpful for a lot of innovation zones last year. You would coordinate the day, the place, the time, and I would be happy to come out and facilitate that training session with your partners. This can take place as soon as you're able to schedule it, and I'm going to follow up with each of you in the coming days to see if that's something you'd be interested in. So here are some key dates. Again, the Priority Population Enrollment Form, Form HN16 or Form HN16 Part A, is to be completed by your participating early childhood education program in your innovation zone using enrollment numbers on October 15th. So again, that point-in-time snapshot. This should be submitted back to you by November 13th so that you could review it, and then you turn it in to me, Renee, on November 20th. We also ask that you complete a brief program list document, which I'll show you in just a second, that helps to track who submitted the data to you. And this will be helpful to see year over year who is submitting that data, give us another snapshot of which programs are participating in data collection. The Quality Improvement Form, Form Q16, will be completed by the Innovation Zone Lead or Coordinator, and you'd work closely with your participating early childhood programs to complete this form on their behalf. This will be quality of the programs as of October 15th, and that, again, will be submitted on November 20th. Here is a really handy little form to track the data you're collecting in the Innovation Zone. Here you would just list the participating programs in your innovation zone, and then you'd simply check off which ones have submitted data. This is really helpful for you to be able to track who submitted data to you and what you're turning into us. So you turn this in with all your forms. There's one for high needs enrollment, and there's one for quality. So where should we submit the data? There's two options. You can email to me, my email address there on the screen, or you can mail the forms directly to me, Renee, at the address on your screen. And as always, if you have questions, you can call me at the number on the screen. Here is a quick step-by-step for data collection. Number one, you're going to get those forms to your team as soon as you can, including the sample intake forms. You'll set up a time to train on the forms. And again, I'm happy to be a part of that. 3, you're going to collect data with the point in time of October 15th. You're going to turn those in to me, Renee, by November 20th. And you're going to ask questions of us as early and often as you can.
We're thinking about, with back to school, so I know that a bunch of the schools started, some of our schools started a week ago, some started 2 weeks ago, a lot of schools started today. So in an ideal world, we would be able to get this information to our different centers and programs so that it's just sort of on their radar, that as new families and as new children are coming in, that we can help get them set up with data collection right away.
So we have a few
questions, I think. Let's see. Okay, so can we ask on the form what is funded enrollment or capacity, and then how many children are you reporting data on? That way we can follow gaps between enrollment and what was reported. I think we have to check in on that one. I think that's a good question, and then we'll get an answer back to you, because I'm not sure if everyone's going to want to share the funded enrollment. I know that the R&Rs have the funded enrollment data, and ICAM has funded enrollment data. I'm just trying to think if there's a simpler way that we can get that information for you. We can ask it on the form, but then I'm wondering if there's an easier way to get that information.
Okay, great. Is that helpful? Yeah, I think that's the only question we have right now. We just have a few more things.
Okay.
There we go. So here are some tips for successful data collection. Again, sharing those intake forms with your programs as soon as you can. Provide all forms and resources to your program. Schedule that data collection information session. This is a great way to build relationships, make the benefits clear, remove anxiety, and make things easier. This really helps to increase motivation for data collection with our partners. Also provide those forms and tools, offer encouragement, offer support. This really helps to increase ability of our partners. Encourage the use of their preferred format of the form. As you saw, we have forms available in PDF and Excel. Also sending regular reminders is a great way to make sure that the data comes in a timely way. And then reviewing all those forms, just to make sure you have all your programs participating in the forms and the data look accurate. And we're also curious what your tips are. Do you have any tips and suggestions for each other in collecting data? What's worked for you? Feel free to type into the chat box or raise your hand. We'd love to hear from you. So we have a question, do programs only report data on children who live in the zip code of our innovation zone? We are interested in the children in that program and where they live, and we're asking that you report whichever zip code they come from. We are interested in the zip codes, your boundaries, your targeted area, but we do want to know if there are children coming in from other neighboring areas.
So to answer that in a different way, because Renee and actually, we read the question a little bit differently. So it would be centers and schools, the programs that are in your zip code for your innovation zone boundary, and then any zip code of a child in that program. And then again, just reiterating that we would be starting with programs where we have the strongest relationship with first. So if you've got 1,000 programs in your community, start with who you have the relationship with first, and then year over year you would be adding programs. You'd be partnering. So it would be kind of that direct pipeline relationship where if I'm making a direct referral, but we do want to know the zip code of the child because that does change. So are we serving more children from your community, from that low-income zip code in that center?
So I don't see any other hands raised or thoughts in the question box. I do want to encourage you to reach out to us, and we'll bring this back to our peer learning call, and maybe we can share some tips and ideas there as well. So we have more resources for you. You've received part 1 of the data collection toolkit. These are all the forms that we reviewed today. Tomorrow we'll share part 2 of the data collection toolkit, and that includes the data collection letter of support. That's again the one from last year from the Governor's Office of Early Childhood Development. We also have a data collection step-by-step guide we'll be sharing that includes some messaging and some ways to make this process easier. We also have a frequently asked questions document that we'll send out, and we'll also include the webinar presentation and the recording for you. And perhaps you need additional assistance. That's great. We're here to support you, and here's our support request tool. This is found on the Google Drive and will be emailed out to you. Here's a simple way just to insert what you need assistance on, the date that you need it, and this is just a really helpful tool for us to kind of track all the different requests that are coming in and to help provide assistance in a timely manner. Great. So after reviewing the forms, process, and timeline, are there any remaining questions?
We see one question that the forms will be sent out today and tomorrow. Mm-hmm.
Yeah, I just want to ask if there are any, if you're, hopefully you've all had a chance to look at the forms. If you notice any issues or problems, if you could send those to me right away, and that way I can finalize any last minute things for you and get you a final draft copy. Otherwise, everything will be shared today and tomorrow. And again, you'll get those emailed, and they'll also be on the Google Drive, and I'll send you out that link again so you have that easy and ready to go for you. I don't see any other questions, and we're nearing the end of our webinar. If you do have questions, feel free to email us, and we will send out the recording by tomorrow, the webinar recording and the PowerPoint presentation for you. We'll also send out the FAQ tomorrow and add any additional questions to that document. So I want to thank you for your time today. We hope the presentation was helpful, and we really look forward to working with you on data collection. And anything else from our team here?
No, I want to thank everybody very much. I really appreciate you taking the time and asking some really good questions. As we said, we're learning from you. You help us make this process better, so the more that we know what's working or not working, the better we can be. And again, the webinar will be archived, and we'll get everything out to you over the next 2 days.
Great.
So thank you, and thank you, Renee.
So much.
I'm clapping. I'm the one who's been here. So thank you, Renee, for putting this together.
All right. Thank you all, and have a great day.
Bye now.